We are a global nonprofit NGO that's focused on supporting humanitarian crises and communities and people with telemedicine and other tech-based solutions. And our why, I think, doesn't really need to be stated, especially for this group, right? We do know that the number of disasters only continues to go up over the years. And the amount of money and economic cost for these, for recovery especially, continues to be massive and continues to increase, with many communities not being able to even fully recover. And those numbers actually don't even include man-made disasters and conflicts that are all across the globe. Those numbers only included natural related disasters. But I do believe from the Health Tech Without Borders side and why we do what we do is really this picture. This is one of our mental health specialists that we work with closely in the field who we support with services. And what's striking to us and to me especially is she's on a laptop that is fully equipped with technology and in a region where there is no power. And that's why she's using candlelight with no infrastructure, but still continues to support and take care of her patients and continue her important work. And that's sort of the world we live in now, where the technology we have, right, has really allowed us to do things that were impossible even just 5 to 10 years ago. That makes it very, very possible, especially in healthcare and improving access to healthcare and reducing inequalities. So from a Health Tech Without Borders side, we are here to connect people in crises. And we define crises very, very broadly, where it could be conflict affected, climate affected, to even just a crisis of the standard day of people in areas with no access to healthcare. In the next, 40 minutes or so, we will be talking a lot about technology, but I just want to remind us all that the underpinning of all this is about the people in need, and the tech is there to really connect us all and doesn't really have to be high tech. We are currently supporting 8 countries, and soon we'll be starting up a program in Cameroon as a commitment to action with the Clinton Global Initiative. And I am happy to report that since our inception at Health Tech Without Borders, we've mobilized over 800 volunteers across 20 countries, completed over 200,000 consults, and provided over 1,000 hours of mental health support. And when we think about how and why and how to actually support, there is a process. In many ways, it's pretty straightforward and similar to many organizations where we always will think and do a needs assessment that is focused on working with not internally just with us, but also with our local partners, friends, and also local NGOs in the region that are already working. We never want to add more noise and only want to add value. So we want to be sure what we do can actually support and not cause more harm. And we're looking to really we are completely tech agnostic, so we can work with different tech partners and bring in multiple pieces, sort of like puzzle pieces or Lego pieces that we can put together between medical expertise, telehealth solutions to EMRs to bring it to a local use case and solution that's needed. And so to illustrate some of this, I just wanted to go through a few quick case studies that we'll have more time to do a deeper dive during the question and answer. So first is after the start of the Russian invasion of Ukraine last year, unfortunately, we also were coming out of the COVID pandemic in many ways and sort of saw that telehealth works well and can be scaled rapidly, especially in humanitarian crises and a worldwide pandemic. And so we put out a call to action, not knowing what was going to happen. And it was incredible what the international community came together with. 40 plus tech companies all offered their tech pro bono, as well as over 800 volunteers all volunteered almost immediately in a short time from 20 different countries. And putting it all together, we ended up completing about over 62,000 consults to Ukrainians within Ukraine by about September of last year. And as you can see, majority of the cases were really around primary care. It wasn't the high-end trauma, anything else that was going to the hospitals and such. But as I think we all know that despite whatever event it is, disaster, there's an acute need to take care of the patients and people immediately who are injured by it. But what is also lost and sometimes forgotten is the sort of loss of medical infrastructure. And it's really the chronically ill and folks with, for example, diabetes or chronic hypertension that get sicker and sicker over time if they cannot get access to medical care or to their medications. We also deployed a medical chatbot that teaches how to put on a tourniquet. So I would think of it as if you ever taken a CPR class, it is very, very formulaic and systematic, where it's 1, 2, 3, ABC. And that's what we built into a chatbot on how to put on a tourniquet if needed. Similarly, we have a second module that's focused on the medical professional to help them with a few advanced techniques. And after us having this go live, I'm happy to report that this was a few months ago, where it's already responded to over 32,000 queries. We have also been working with different teams throughout, and with some partner NGOs, we were able to drop a container classroom that was fully equipped with technology, as you see, laptops, internet service, as well as power, AC, and heating. And the power has solar panels, as well as a way to integrate and plug into the local power grid. And as you can see, it's very mobile. This one was delivered to a rural nursing school in Ukraine to support their education. Lastly, I just want to mention that we're also working with augmented reality. This is the HoloLens. We are also working with the Blade 2, and there's different, gadgets out there to do this. And surgeons have been using these, as you guys know, for decades, or for at least years, where they could support each other in the operating room in real time, no matter what location it is across the globe. And we figured that we could probably use these to support amputees, especially with physical therapy, occupational therapy, and prosthetics, because it's a very high-touch field like surgery. So we've been working with our local MIT Media Lab with AI-based where you can actually watch a patient with a prosthetic walk down a hallway, and it could follow them and map it out and help us determine how to modify that prosthetic over time. And so lastly, I just want to say that, technology today in 2023 is pretty amazing, right? To the point where we can do a lot. We can improve access to care. And with the correct resources, whether it's our group or any other organization working in this field, I do believe that we can rapidly scale and help and support much more patients, especially in the healthcare field. And this is our incredible leadership team, knowing that we also have an incredible amount of volunteers behind us that are not pictured here. We would not have been able to get anything done without this, kind support of all these folks. And I will turn it over to Eva.
Mental health is a big component to what we do at Health Tech Without Borders. We do have several current projects, and I will talk about some of them. One of the biggest projects that we have is directed towards the supporting providers who are working in humanitarian crisis zones. They face unique and profound mental health challenges due to the demanding and often traumatic nature of their work. The need for people in healing professions is staggering, and the impact on people in need is hard to estimate. But quite frequently, the mental health providers and healthcare providers are also the victims of a direct trauma, and they are also experiencing the full impact of the disaster. So the rates of burnout, PTSD, and compassion fatigue are very high among the healthcare and mental health providers working in the disaster zones. And at Health Tech Without Borders, we believe that it's our duty to ensure that the healthcare workers and mental health clinicians working in crisis zones receive the mental health support they need and deserve. And I do want to say that it's not only ethical imperative, of course, but it also a strategic investment in the resilience and effectiveness of the host country healthcare system throughout capacity building actions, adaptation, and preventive interventions. Next slide, please, Dr. Lee. So that is how the Helping Heroes Heal program has been developed. The aim of the program is to support mental health clinicians and healthcare providers working in the humanitarian disaster zones. Helping Healers Heal is well positioned to address the mental health of those who are healing the wounds of others, be it physical or psychological. We developed a support system based on lessons from the COVID-19 pandemic and evidence-based interventions to prevent and mitigate mental health issues occurring in healthcare and mental health providers during humanitarian disasters. The issues like burnout, compassion fatigue, anxiety, PTSD, to name a few. But what is important is that we don't only address the emotional or experiential issues they encounter during the work, we'll also help them navigate through complex ethical challenges, such as feeling of moral injury that are unavoidable in the morally imperfect setting of humanitarian disaster. Through telehealth, we are able to provide and continue to support mental health clinicians in Ukraine and healthcare providers in Turkey. As you can see, over 200 mental health clinicians participated in our webinars. 10 mental health specialists trained by Health Tech Without Borders currently provide peer-to-peer support through telehealth to mental health clinicians, to 40 local mental health clinicians. I do have to point out that 4 of the 10, as we call them, mentors, are local providers who felt the benefits of the program and expressed the desire to join our program and help their colleagues. In total, we have provided over 1,025 hours of support and indirectly made an impact on over 4,500 patients who were able to receive much needed help and care from clinicians who are supported by Helping Healers Heal. Next slide, please. But we also appreciate and understand that a great number of people might not be able to have direct and quick access to mental health providers. So this is sort of our second ongoing project. We are partnered with MindStep and Sora Union to create an interactive self-help app in the Ukrainian language that will be accessible with time to Ukrainian refugees outside and inside of Ukraine. The app is based on already existing mental health app developed by MindStep, but it has been significantly modified and revised to address the needs of Ukrainian refugees. In its current version, it is based on evidence-driven trauma-focused cognitive behavioral therapy for post-traumatic stress disorder, but it also will be able to assess anxiety, depression, and cognitive functioning. And as we develop the app, we incorporate typical themes and needs of refugees, as well as very important cultural specifics such as appropriate language translation, interpretation, and understanding of the terminology, and contextually based approach to mental health. So the content of this app is multimodal, so we will have psychoeducational information to increase knowledge awareness and of symptoms of anxiety. It also symptoms of anxiety, depression, or PTSD. It also has self-help techniques. We will also have skill training for symptom management. And in addition, a short-term self-test on each of the specific modules, including the one on post-traumatic symptoms, is developed to allow for automated tailored feedback regarding progress at any time. Interactive materials such as animated videos and audios will provide to maximize usability and interaction, and important information and phone help numbers will also be provided to the users. So we are very hopeful that this will have a significant impact on improving the mental health of Ukrainian refugees. And I do want to say in the end that addressing the mental health needs of people in crisis zones is paramount for their well-being and for the effectiveness of crisis response effort. Health Tech Without Borders will continue to support those who are affected by the crisis, those who are suffering and hurt, and those who are in need of restoration of their well-being, be it physical or mental. And telehealth is one of the venues to do this. We are committed to rebuilding and supporting the capacity to heal and adapt, and we are committed to supporting efforts to helping create conditions resulting in human flourishing even after the most devastating humanitarian crisis.